Thank you very much for staying with us here on The Full View. President Cyril Ramaphosa and his cabinet have concluded an urgent cabinet meeting as the country experiences rapidly rising coronavirus cases. The president is set to address the nation. It has already addressed the nation on the outcomes at this hour. The number of confirmed cases in South Africa has now risen to 61, as we heard from the president. In studio, we are now joined by Chief Economist at Econometrics, Dr. Azar Jammine. Dr. Jammine, always a pleasure to see you. Thank you so very much for joining us here on SABC News. Good evening to you. I mean, you would have heard the president talking about the fact that a lot of measures, I mean, so there's some stringent measures here that cabinet has decided to follow in order to try and stop the spread of the coronavirus. We're talking to you about the economy, and I mean, this will be a huge impact on the economy. The fact that people are being told if they can stop going to places where there are too many people, that they shouldn't go there. What are your views on what the president has just said today?
I think the president has responded to what is a worldwide pandemic. Until recently, we felt comfortable in South Africa that the virus was not spreading too badly within the country, but the speed with which it has been spreading around the world has been nothing short of alarming, and that was why financial markets, well, they've been heading for a crash for a long time. But this, I mean, what it means for business around the world is fairly disastrous from a short-term point of view. Because with people not being able to associate in any groups, business activity is going to be curtailed fairly dramatically across many different sectors. Yes, it won't come to a standstill, because fortunately in today's day and age we have electronic forms of communication, and a lot of activity will be conducted through electronic means and through telecoms and that kind of thing, which in years gone by we would not have been able to do. Nonetheless, the fact that people cannot move around freely is going to result in a sharp reduction in production of all sorts of goods and services, such as we saw last week with the extraordinary decline in car sales in China as a first manifestation of what happens.
Mr. Jammine, I was reading an article, British media, but in any case, I was reading this article which said that we should now prepare ourselves for a global recession. Do you at this point sort of agree to this? I mean, what initially seemed like a sort of a localized, I suppose, problem in China is now worldwide. Will the pain go on for much longer than we had expected? And I suppose the president's speech today sort of indicates that, doesn't it?
I think the realization has dawned on us that it is a far more serious thing with more significant ramifications than we thought. It's been changing by the day. People's expectations and forecasts have been changing virtually by the hour. And that was why financial markets took such a hit last week and are likely to continue doing so in the coming week, because people are now realizing what it means for the world economy and for economic activity generally. The hope is still that once this is all over and the virus dies down, we'll go back to normal. But I think there's also a realization that there's going to be a lot of peripheral damage that is going to take a long time to recover. One of that being, of course, now we realize that there's a lot of financial problems that are going to crop up all around the world that we have not, you can't just close down for a month and think nothing's going to happen. And you can't see equity prices and bond prices falling the way they did on Friday or on Thursday and think that there's going to be no fallout from all that.
Mr. Jammine, I'm going to keep you here with me in the studio, but we have to cross to Pretoria, of course, to the Union buildings where our reporter Samkelo is there. Let's cross live to Samkelo. Samkelo, of course, the president just spoke, and we've heard all the sort of remedial action, or what cabinet has, the measures that cabinet has given us going forward in terms of what to do with quelling this disease, this virus. What can you tell us about really the president's demeanor? I mean, I was looking at him and he looked very concerned from where I was standing, Samkelo.
Yes, the President did address the nation this evening, where he imposed a number of travel bans to countries that are largely affected by this pandemic: the United Kingdom, China, Italy. They've all been banned from traveling into the country. Those who've had their visas, those visas have been revoked by the government of the day. Ports of entry into the country, 72 of them will be affected by this particular pandemic. Some of them will be closed down with immediate effect. In the words of President Cyril Ramaphosa, there will be also restrictions on mass gatherings. No mass gatherings above 100 people are allowed to take place. Significant events that are meant to be commemorated in the coming days in South Africa will also be cancelled. You know that the President was meant to address human rights there, but I'm also going to bring in political editor Mzwandile Mbeje just to speak on these issues being raised by President Cyril Ramaphosa in a very frank and decisive speech he gave to the nation. Mzwandile, a very decisive president, speaking very forth of this pandemic and a grave emergency that has affected the country in his own words. What do you make out of the decisiveness of the president this evening?
I think the president knew that he was left with no choice but to make tough decisions. In fact, I think tomorrow when the ministers are unpacking this issue, there's something that is coming out here which is, I think, of great concern. Remember, all the cases that have been reported were largely from outside. But it's clear now that we have local transmissions, which is a great concern. And I think he was left with no choice but to be very bold about it. I mean, banning public gatherings and making sure that the high-risk countries don't come here. So it's really, it was really necessary, because for how long were South Africans going to complain and then no action was being taken from the head of state? So I think this will go a long way. I mean, even on the issue of the ports of entry, 72 of them, and then 35 of them will be completely shut down. So it would be very interesting to listen to the ministers tomorrow when they unpack the speech, because there seems to be a lot of things that the president spoke about, but of course they need unpacking.
Mzwandile, he goes on to say that unnecessary travel within the country must be stopped. Traveling by bus, traveling by train, traveling by on air, flying, unnecessary travel must all be curbed. Unnecessary traveling by taxi. What do you make of this from an economic aspect of the country internally?
It will absolutely affect the issues of the economy greatly. But remember how this virus is transmitted. It's transmitted in those groups. I mean, when the president says we discourage even the taxi, trains, bus, so that does indicate to you that something is really happening. As I was saying, the fact that now local transmission is taking root is a great, great concern. And if you listen to his speech as well, he did indicate that they are busy finalizing the package, the economic package, because somehow the economy will be affected, and then they need to come up with a system or rather a package that will somehow mitigate the seriousness of the economy that is being affected very negatively.
How would those the president would have been consulting with reacted to this news that he was delivering to the nation today? He had spent about 2 hours consulting the various stakeholders he needed to consult. How would they be taking some of the measures and the drastic decisions that have been taken here? It will be effectively affecting their pockets at the end of the day, and revenue generation.
Well, the fact of the matter is that you can't focus on revenue generation only now, when tomorrow that revenue generation will be wiped off completely. Yes, it would have been hard to hear that, but I think they would have to understand that under the circumstances, the president was left with no choice. Because if you want to insist that you don't want to change the way you do things, so you are affecting the next person. That is why, I mean, he said, even when you're coughing, so we have to cough in a particular way. The way we relate to each other, we have to relate in a particular way, because this virus is changing the manner in which the globe relates to each other. It's a fact, it's a reality, and there's nothing that we can do. We have to comply, because if we don't comply, we'll be the biggest victims here.
Zondile, we're going to pick up this issue later. I'm sure that they have to go to another briefing at the Sheraton Hotel. The president saying that this is the most definitive Tumamina moment of the country, saying that we've never been defeated by anything. It's time for all South Africans to pull together and work together, calling on companies, unions within the trade union movement to work together, churches, universities to all come together and deal with this particular pandemic, which is a grave emergency, in the words of President Cyril Ramaphosa, who may lead the country today and taking them into his confidence.
All right, thank you very much there to Samkele and, of course, Mzwai, who have been at the union buildings throughout this very long day. So thanks very much for that. We're going to cross over now live to our U.S. correspondent just to give us more information. Showan Bryce Pease is on standby just for some reaction. Showan, a very good evening on this side to you. Now, you would have heard that our President Cyril Ramaphosa has issued travel ban on foreign nationals from high-risk countries, one of them being the U.S. I mean, initially, we saw President Donald Trump not really particularly taking this virus very seriously. At some point, he said something like, oh, it will go away. Has the tone now changed? And is there reaction yet at this point about South Africa even saying we're imposing this ban on even the U.S. travelers?
The Africa flow is not necessarily unique. Of course, the President Ramaphosa now declaring a national. You will know that the President of the United States stood in the Rose Garden on Friday and declared a national emergency. That might mean different things in different countries. What it means in the United States is that he activates a disaster management fund, $50 billion to be administered by the Federal Emergency Management Agency in the United States. You only often hear about FEMA when we talk about natural disasters, hurricanes, and the like, but this now being treated as a national disaster here and around the world. And just a bit of advice to South African officials based on what we are seeing in the United States right now. In terms of these travel bans that you mentioned, what sort of capacity is being implemented at ports of entry, at airports in particular, going to be increased? The reason I mention this is because we've had several thousands of people delayed as they have been trying to re-enter the United States. We know that the United States has issued a travel ban on the European Union, the United Kingdom and Ireland afterwards this weekend. But the problem is our bottlenecks at the ports of entry for the flood of Americans returning to a safe haven to get home. So in terms of capacity, that will increase if testing is going to be increased at that point. Hello?
All right, Showan, we're having a very bad connection with you. Let's try and get our staff members here just to help us out with that one, our technical crew just to help us, and hopefully we'll get you back with us on a better sort of line just for the sake of our viewers. Let me continue then with my guest, economist Azar Jamin. Thank you very much for staying with us. I mean, it's difficult, isn't it, at this point to balance, Mr. Jamin, the safety and protection of people with the inevitable problems that this disease will cause, or has already caused for the economy. Let me put it that way. What do we do in this sort of a situation? Because you can't kind of say to people, well, carry on shopping, carry on doing, we've already been stopped. So what are we supposed to do? I mean, you look at the restaurant business, for example. If I'm visiting my favorite restaurant once every 2 weeks, and I'm not visiting now, I'm not going to, after all of this, go there once every week to make up for it. I mean, these businesses are in trouble, are they not? You are absolutely correct. A lot of business activity will be gone for good as a consequence of this. And, cynics will say, has it been worth trying to fight this virus given that a lot of people are going to starve and probably die of poverty as a consequence of the actions taken to try and preempt the virus. And for our workforce, I mean, what's the advice? I mean, we might find ourselves in a situation where, companies are saying, look, we actually just don't have work. We don't even have customers. We don't have clients. So what do we do in this case? I think, some companies are going to lay off people on a part-time basis, just temporarily, and hope that business comes back in the longer term. And so there is going to be a lot of impoverishment of people as a consequence of this. There's no doubt about it. Not across the board,
there are some businesses that will actually benefit from this, ironically. But the kind of examples that you gave of restaurants and so on, that's obvious. The tourist sector is completely decimated internationally. And the only way in which we're going to get through this without even more damage is government now. This is a role that governments finally have to play. They don't have to really be worried about managing airlines and electronic companies and all that. This isn't a case where government has to intervene in giving direct assistance to parties that are damaged.
We heard the president saying that there is a fund that will then be made available to those businesses as we go through this problem. I mean, what does that actually mean? Does that mean that the president will be making sure that these businesses stay alive for an inevitable amount of time? What do you think the president means by the fact that there is this fund that will be made available to help these businesses?
By the way, our president is certainly not going to be the only one in the world facing this problem now. So let's just not believe this is a strictly South African problem. What the world has to find out is how to package all these loans of central banks towards businesses in an organized way that is not exploited, but actually goes to people who really need it. And from a fiscal point of view, we've also got to do this, and we've got to be very careful, because if you overdo it, you can actually have converse repercussions that weren't foreseen previously. So it's got to be managed extremely carefully and extremely well directed. Hopefully the government will take advice from international sources, and I think there's going to be a concerted global way of dealing with this all in due course.
Now, is it fair for me to ask how long it will take consumers and business confidence really to recover after we come out of this sort of, I suppose, dark tunnel?
That is the huge question that people are posing at the moment. A lot depends on how quickly we find ways of dealing with the virus, how quickly it dissipates or not, obviously. But even with what has happened over the past week, we're talking several months, if not the entire year. The world economy is without doubt going to go into a recession. The only hope that exists is that there might be light at the end of the tunnel if we succeed in doing away with the virus. The virus has not been quite as deadly as many other viruses. I mean, if this had been Ebola, God, I would have been scared to be in the studio. But we are looking at now, whereas previously people were looking at the second half recovery. You may get some recovery, but there will have been some permanent damage inflicted. And what concerns me specifically is the manner in which financial markets are crashing. I think there's a lot of peripheral damage that is being incurred over and above the supply shortages that end to tourism. There's a lot of financial damage that is now that we're headed for globally.
All right, let me cross back to the US then, where Sherwin Bryce Pease is. I hope that we've got him on a somewhat better line there. Sherwin, we were having that conversation about, how the tone has sort of changed then in the US. I see that the number of cases has now surpassed 3,000 in the US. Can you tell us what exactly the US is now doing in terms of trying to, sort of limit those numbers? I mean, 3,000 is quite a staggering number, isn't it?
Yeah, over 3,000, over 50 deaths nationwide. We are seeing cases in 49 of the 50 states, Flo. And as we were talking earlier, before we got cut off by the bad connection, I was talking about how this was declared a national emergency by President Trump on Friday. And what that does is it makes available, gives the federal government access to a $50 billion emergency disaster fund that will be administered by the Federal Emergency Management Agency known as FEMA. We often use that acronym when we refer to responses to hurricane disasters or other natural disasters in the United States. FEMA will now be coordinating on a national level, and the big the big three things that we hear from officials here to focus on is testing, and more testing. Once you get testing nationwide, you then have a better understanding of the number of cases that you need to deal with, and only then will the response be measured in terms of what is required. We're also hearing from one of the the hotspots in the country, New York City, New York State, the governor of New York State earlier, Governor Cuomo, urging the federal government to deploy the Army Corps of Engineers, because there's a big concern, Flo, that as the numbers, due to an increase in testing, as those numbers now escalate, there's going to be a greater need for hospital beds, and there are just not enough beds in the American healthcare system to deal with the potential demand that will be required. We are seeing figures that up to 2.4 million to 21 million people in the United States could require hospitalization, and you only have less than 1 million beds. We are also seeing worst-case scenario models being issued by the Centers for Disease Control. They are saying that between 160 and 214 million people in the United States could be infected. Now, that sounds like an astronomical figure, right? That's almost 60-70% of the U.S. population. But not everyone will necessarily show symptoms. Not everyone will necessarily need to be hospitalized. Of course, older populations are the big focus here. But as many as 200,000 people, up to 1.7 million people in terms of these models, Flo, could die, says the CDC. This is worst-case scenario. So a lot of planning here, a lot of testing required so that the scope of this epidemic really needs to be understood so that the response can be measured in terms of that.
I mean, I hear you talking about, beds being available. And I mean, a situation like this will expose really the loopholes in the healthcare system of any country. I suppose will be exposed as well, and so will the U.S. This past week has really been a sort of signaled a turning point in America's healthcare emergency, hasn't it? I mean, we heard Trump saying that the virus will not have a chance against us, but obviously that's sort of a pre-game talk and, prepping people in America. But really talk to us about some of the loopholes or some of the gaps that have been exposed in the healthcare system in the U.S. caused by this pandemic.
Well, the gaps have been in testing. Initially, there's a figure going around that less than 30,000 tests have actually happened across the United States. So we just don't know the extent to which this outbreak is prevalent in communities around the country. We know that there are big clusters in parts of California. We know that there are big clusters in parts of Washington State, parts of New York. New Rochelle is a city just north of Manhattan where we are, and it's the first containment zone in the United States. The question remains, as testing now is upscaled, as federal agencies are saying will happen this week, to what extent are we going to see further or greater clusters around the United States, and what will that mean in terms of getting the National Guard onto the streets, in terms of being able to manage populations that are confined to certain quarantined areas? So testing has been the big issue here, but with the release of this disaster fund of $50 billion, you've seen also the United States Congress, the House has passed a coronavirus relief bill, a bipartisan legislation that will, for example, extend paid sick leave to people for over 2 weeks. Paid sick leave, of course, not mandatory in different states in this country, which will be shocking to many South Africans to hear. Up to 3 months of paid family leave and medical leave, to expand federal funding for Medicare. Medicare is essentially a program that deals with the healthcare needs of the poorest of the poor. So, legislation is one part of it. Accessing disaster relief finance that can be expanded to the states. Essentially, what that $50 billion does is states can then apply to the federal government for funding in terms of the upscaling of their emergency response. The fact that military bases and various community centers need to be converted into wards to hold more patients. That costs money, and that's why the central fund of $50 billion is going to be very important, A, to expand the healthcare system to more people in this country, and to increase testing so that one understands exactly what the need in different communities is.
I'd just like to, out of interest, talk about the reaction, or I suppose how U.S. citizens are really reacting to this coronavirus. I'm sure, Sherwin, you would have seen on social media that for quite a while, South Africans weren't necessarily taking the virus very seriously and thinking that it wasn't going to affect us in any way. And now we're seeing a sort of a change. And I think after the president spoke today, there might be a sort of a change in attitude coming from South Africans. But talk to us about how Americans have been been, dealing with this issue of coronavirus, have they been quite serious about it as opposed to what, the Africans on this side have been?
Well, the big concern, since we're in New York City, it's one of the most popular cities in the country. It's a conduit for people coming in and out. JFK, this is a big transit point for people coming into this country. Airports are empty, unless we're talking about the crush of people that are trying to get back into the country because travel bans are kicking in. But the big concern that has been expressed certainly overnight by New York officials is the fact that bars and restaurants remained opened over the weekend, and these tend to be confined spaces, and a lot of young people, revelers, are not heeding calls in terms of the social distancing that is required. Look, South Africans are their lives are about to change fundamentally. As a parent, Flo, as you mentioned, you're a parent, your kid is not going to be able to go to school come March 18th. There's an economic cost associated with that. There's the anxiety. As much as the president is saying, it's going to be after Easter, or, we'll cut short the Easter break, the point is they actually don't know, because they don't know the extent of the virus. You have to test to really understand what these deadlines are going to be. If you look at what the sporting world is doing, the NBA, the National Hockey League, Major League Soccer, they are suspending their seasons without saying we're going to be back on such and such a date. So there's a great deal of unknown here in terms of, people are not necessarily panicked, but there's a great deal of anxiety. When you see the lack of rush hour traffic in the morning on your way to work, when you see a vacant, an empty subway system or an empty bus system, which is generally congested. And what you're seeing from a lot of companies, and this is what President Ramaphosa was also talking about in his address a short time ago, is the urging for companies, for businesses, for the private sector to take the initiative and let people work from home. You're seeing stores like Apple close all their stores. You're seeing Nike taking the same move, and various other retailers. So we are in a very strange scenario. The United Nations Secretary General sent out a letter to staff on Friday, Flo. If you just give me a little bit, all staff will be required to telecommute unless their physical presence in the workplace is needed. That's the kind of messaging you're going to see more from South African companies, as we are seeing here in the United States.
And just in closing, the US is obviously huge. Can you maybe paint a picture for us of, which states are really the concerning sort of states when it comes to the coronavirus?
Look, it's before President Trump declared a national emergency, over 30 states had individually declared states of emergency in their jurisdictions. The hotspots, though, are the big centers. New York City is you're seeing a big cluster of over 200 in New York City. In New Rochelle, there's almost 200 cases. This is a city just north of where we are here. Washington State has been a very big hotspot. We've seen the most number of deaths come out of that state. California. So states that tend to have large populations and states that tend to have the populations that travel. If you look at New York City, it's one of the financial capitals of the world, it's one of the business centers of the world, and it's also the home to the United Nations. So you can understand why a state like New York State, as opposed to Indiana, will have more cases, because there's just more traffic from people coming abroad. So, different states responding differently, greater need in certain areas. But this is affecting everybody. Everybody's behavior needs to change. That social distancing is very important. This is a different ballgame for all of us, and we're all in this together. South Africa, the United States, the world, the Flo.
All right. Well, you know what, Sherwin Bryce, please, we appreciate your time. Thank you for that. And of course, as you would have heard then from the president, the U.S., those coming from the U.S., a travel ban on foreign nationals from high-risk areas, and of course, the U.S. being one of them. And of course, Sherwin Bryce, please, painting us a picture really of what's going on in the United States. I'm going to wrap up my conversation with Mr. Azar Jammine, our economist here in the studio. Just to wrap up, Mr. Jammine, I just want to ask you from where you stand, and I suppose this is a subjective sort of question because everyone would have a different answer to it, but do you think that the timing that the president used now to sort of shut down the economy, if one wants to exaggerate it in that way. Was this a correct time, or could this have been done a lot earlier? I mean, we watched what was going on in China, and perhaps maybe that would have been the point at which this should have been implemented. Some would argue that, or some could argue that, it's still not a problem. We're only sitting at 61. I don't know what people are thinking, but is the timing correct?
I really don't believe that one can criticize the government for delaying an announcement such as this. The speed with which events have unfolded over the past week has been breathtaking. And truly, I mean, at the beginning of last week, there was really nothing to make one believe that the situation was going to explode in South Africa. And even today, even with 61, it's not a huge number. And I would concur with the government in saying this is not time to panic. We are instituting these measures now because I think South Africa is currently in a better position to actually control the virus right now than many other countries by doing exactly what it's done. To say that it should have done this on Wednesday or Thursday, I think, is a little naughty. I think that this was appropriate at the appropriate time.
You used the word panic, and one of the words that, one of the things that I've been quite concerned about is that of panic buying by consumers. You might have seen that, on the shelves we can't get, hand sanitizers. In Australia, there were people fighting in grocery stores for toilet paper, for instance. I mean, what do you make of that? I'm concerned that after this announcement by the president, that people will be running to the stores to make sure that they're stocked up,
I think it would be a total overreaction by people, and I think the president's call for Tumamina is precisely to try and preempt people thinking only about themselves and not about their fellow human beings next to them. This is a national effort, and I commend the president for actually making the point that, guys, this is where we all work together, and it doesn't matter which political party you support, what your affiliations are, we all work together.
Mr. Sarjamin, I think we'll leave it on that positive note. Thank you so very much for giving us your time here on The Full View on SABC News. Thank you.
It's a pleasure.
All right.